Hello everyone, my name is Adam Carball and this is my informational speech on COPD. The average person takes a breath every 6 minutes without them even realizing it. The normal respiratory rate is between 12 to 20 breaths per minute. During the breathing process, carbon dioxide from your blood is removed and replaced with oxygen. Gas exchange occurs in small air-filled sacs called alveoli. The alveoli are there to increase the surface area for gas exchange. That's why they're in little clusters like so. Chronic obstructive pulmonary disease is a non-infectious, lower respiratory disease that includes both emphysema and chronic bronchitis. During nursing school, I learned a lot about the respiratory system, and it has always fascinated me. So today, I would like to inform you about the pathophysiology, symptoms, and how to reduce your risk of COPD. COPD causes a decrease in gas absorption in your lungs, but it also is a problem of causes hyperinflation of your lungs. So COPD is emphysema, and chronic bronchitis. Emphysema is a decrease of elasticity in your lung tissue, and this causes hyperinflation of your lungs, which causes dyspnea or difficulty breathing. So also there's increase of protease, and this enzyme can break down protein and peptides in your lungs, and it can break down the elastin fibers in your alveoli, which in turn causes you to retain more oxygen. And this causes, when they get broke down, it causes bullies, which are big air-filled sacs that do not extend on their self. So here we have an example of the alveoli with the emphysema. So there's just a big opening without the small inner networks. And here we have a picture of chronic bronchitis, which is just a constriction in your bronchioles. Chronic bronchitis is inflammation of your bronchioles, and it's caused a lot by irritants like smoking or burning of biofuels or anything like that. The increased constriction of your bronchioles also increases the mucus production, further blocking them. So now we know what COPD is. Let's go over the manifestations. The symptoms of COPD are hypoxia, respiratory failure, respiratory acidosis. They usually have a fast, shallow respiratory rate, and they also more have barrel chests and skinny extremities. It can also cause right-sided heart failure, which is called cor pulmonale, which is manifested by distended neck veins and has hypertrophy of your right ventricle, which is a muscle enlargement, allowing it to fill up with blood less, therefore causing issues. So smoking is the #1 cause of COPD. If you smoke, I'd advise you to quit or have a cessation program. Also, asthma is another risk factor. You can't prevent asthma, but a good way to start would be just to, if you have asthma, to control it. So COPD harms the quality of life of the patients that have it. It is chronic bronchitis and emphysema. If you quit smoking, it decreases your risk. So thank you all for your time, and this concludes my presentation.